this is our last content video module, and I'm very sad to say that our time together is about over. I've enjoyed every minute of it. We're going to think for a few more minutes together about the future of pharmacy, and really we've been doing that for the past 7 weeks, haven't we? We've learned that pharmacy has progressed significantly from its humble beginnings. We know that particularly in American pharmacy in the 20th century, there's been significant change toward more of a patient-centered practice, as an example. But what do our pharmacy associations think in terms of where we seem to be headed? And more importantly to me, what do you think? I'm going to ask you to think about what we've talked about for the last 7 weeks. And on this slide, we're looking into a crystal ball and we're thinking about many of the pharmacy fundamentals that we've studied together. And if you think about things like medication therapy management, wow, there's something that could really change our future and really seems to be changing our present as well. If we think about things like telepharmacy and health disparities among populations who are not receiving appropriate care, how can we make that better? Even things like specialized pharmacy practices through BPS, residency training, transitions of care could significantly change how pharmacists practice. All of these things that we've studied can have significant bearing on our future, but maybe the very first pharmacy fundamental may be the one that has the most bearing, that is our covenant with the patient. If we think about our covenant with the patient, our future will be solid. I've asked you to read a document called The Future Vision of Pharmacy Practice that's posted to our website as a required reading. It's a 2-pager written by the Joint Commission of Pharmacy Practitioners, or JCPP. This is a conglomeration of 11 pharmacy associations which took a look at the future in this case, and they've done other things together. And they looked at pharmacy practice in the year 2015, so this is not so far away. Basically, as it shows you on this slide, they believe that pharmacists will achieve public recognition that they are essential to the provision of effective health care. Now I want to kind of drill a little bit deeper into some of the statements in this vision of pharmacy practice in 2015. First of all, their overarching vision statement, which is here. Pharmacists will be the healthcare professionals responsible for providing patient care that ensures optimal medication therapy outcomes. Responsible for providing patient care that provides optimal medication therapy outcomes. We think about MTM and all the things around MTM and transitions of care and all those sorts of things. What will we do to better serve the patient to get better medication therapy outcomes? They talk about the foundations of pharmacy practice and that pharmacy education will prepare pharmacists to provide patient-centered and population-based care that optimizes medication therapy, to manage healthcare system resources to improve therapeutic outcomes, and to promote health improvement, wellness, and disease prevention. So when we studied educational pathways in the field in week 2, we talked about our PharmD training and how that entails a didactic approach as well as experiential approach to all these things that they are predicting for 2015. How will pharmacists practice? They say that pharmacists will have the authority and autonomy to manage medication therapy and will be accountable for patients' therapeutic outcomes. In doing so, they will communicate and collaborate with patients, caregivers, healthcare professionals, and qualified support personnel. So we will have the authority and the autonomy to manage medication therapy. So I encourage you, if you haven't got the message already, MTM, Medication Therapy Management, is a window to the future. And I want you to study that carefully and think about its implications for your future in this field. So here's the discussion forum question, our last one, and obviously I don't have any other pharmacy fundamentals for you today. And that is, what is your future vision of pharmacy practice? What do you see coming? Do you think that we're going to meet this vision that JCPP envisioned? And then what will you do to position yourself for success in that future? Well, this is our final video time together. I have enjoyed it, as I said before. It's been immensely exciting for me to spend this time with you. Eleanor Roosevelt said that the future belongs to those who believe in the beauty of their dreams. I want to say that I hope you've learned a lot about pharmacy in this Introduction to Pharmacy course, and I hope that you'll realize your dreams as well. All my best to you.